Hi, this is Nidha. Welcome to my channel. Today's discussion is medical surgical nursing. Let's enter into question answer session. First question, that is about which of the following arterial blood gases should the nurse anticipate in decline with a nasogastric tube attached to continuous suction? Options are 1. pH 7.25, PCO2 55, bicarbonate 24. 2. pH 7.30, PCO2 38, bicarbonate 20. 3. pH 7.48, PCO2 30, bicarbonate 23. Fourth one, pH 7.49, PCO2 38, bicarbonate 30. These are the options. Then correct answer, it is fourth option, pH 7.49, PCO2 38, bicarbonate 30. Why we selected this answer? This is because, read the question again, nasogastric tube attached to continuous suction. It means it causes loss of gastric juice, loss of gastric acid, hydrochloric acid, loss of acid from our body that leads to metabolic alkalosis. That's why we selected the last option, pH 7.49, PCO2 38, bicarbonate 30. Think about metabolic alkalosis. So what is meant by alkalosis? The blood pH that is between 7.35 to 7.45, that is normal. If it is above 7.45, that is alkalosis. 7.35, if it is below 7.35, it means it is acidotic condition. So the pH 7.49, it means it is alkalosis. Then we should reach the answer metabolic alkalosis. See the value of bicarbonate. It is 30. It is elevated. It means it is metabolic alkalosis. Clear, no? See the value of carbon dioxide, PCO2. It is 38. It is within the normal range. That's why the answer is the fourth option, metabolic alkalosis. Okay. Then a few points about the anticipated arterial blood gas in decline with nasogastric tube to continuous suction is metabolic alkalosis that result from the loss of acid. That point you have to keep in mind. The loss of acid or excess alkali in the body. Excess alkali means excess bicarbonate in the body that leads to what? Metabolic alkalosis. Okay. It's a case of uncompensated metabolic alkalosis. Why? It is uncompensated because there is no compensation happen in this case. Why? Because PCO2 is normal. If there is compensation, it means the bicarbonate and PCO2 has to change, has to move in the same track. It means when bicarbonate elevate, PCO2 also has to elevate. When bicarbonate decrease, PCO2 also has to decrease. That is known as what compensation. But in this case, the pH is not normal and one value, that is PCO2, is within the normal range and bicarbonate that is elevated. That's why it is a case of uncompensated metabolic alkalosis. Okay, we can go to the next question. Question number 2. Which assessment is most important for the nurse to make before advancing a client from liquid to solid food? Options are bowel sounds, chewing ability, current appetite, food preferences. What is the correct answer? Chewing ability. Why we selected this answer? Because before introducing any diet, that including liquids, we have to do what? Check bowel sounds. It means bowel sound should be present before introducing any type of diet. In this case, we have to change the diet from liquid to solid. So that's why the nurse has to assess the client's chewing ability in order to avoid risk of aspiration. Understood? That's why we selected chewing ability as the correct answer. See the third question, question number 3. During history taking of a client admitted with newly diagnosed Hodgkin disease, which of the following would the nurse expect the client to report? The question is regarding Hodgkin disease. Then the nurse has to expect the client to report. So think about what are the clinical features of Hodgkin disease. It's a type of lymphoma, Hodgkin lymphoma. It is characterized by fever, malaise, painless enlarged lymph node, then night sweat. See the option, weight gain, night sweat, severe lymph node pain, headache with minor visual changes. So the correct answer is what? Option number 2, night sweat. Okay. We can see few points about Hodgkin lymphoma. Assessment of a client with Hodgkin disease most often reveals enlarged painless lymph nodes, fever, malaise and night sweats. Weight loss may be present if metastatic disease occurs. Headache and visual changes occur if brain metastasis is present. The most common assessment finding in Hodgkin disease is the presence of large painless lymph node, often located in the neck. Biopsy of the node reveals the presence of a special type of cells. It is known as what? Reed-Sternberg cells. Keep in mind the point. What? Reed-Sternberg cell. Okay. So we can go to the next question. Question number 4. A nurse is changing the tapes on a tracheostomy tube. The client coughs and tube is dislodged. The initial nursing action is to. Options are: call the physician to reinsert the tube, ventilate the client using a manual resuscitation bag and face mask, cover the tracheostomy site with sterile dressing to prevent infection, call the respiratory therapy department to reinsert tracheostomy tube. What will be the correct answer? We have to think about what ABC. Okay, so the options 2, that is the correct answer. Ventilate the client using a manual resuscitation bag and face mask. That is the correct answer. Okay, keep in mind 2 points. In CPR, we have to follow CAB, circulation, airway, breathing. We have to give more importance to circulation, so give compression first. Then another point, try to expand AMPU. It is artificial manual breathing unit. Okay, we can go to the next question. Question number 5. A clinical nurse instructs an adolescent with iron deficiency anemia about the administration of oral iron preparations. The nurse tells the adolescent that it is best to take the iron with which item? Options are cola, soda, water, tomato juice. What is the correct answer? The answer is the 4th option, tomato juice. Why we selected tomato juice? Because it contains ascorbic acid. It's vitamin C. Vitamin C that enhances the absorption of iron preparation. Okay, few points about iron requirement in our body. Adult men and postmenopausal women require 1 mg iron. Menstruating women 3 mg. Pregnancy 3 to 4 mg. Infants up to 4 months 0.5 mg. Daily iron loss from our body 1 mg. Okay. What is iron deficiency anemia? It is characterized by supply of iron to bone marrow is inadequate and total body iron is deficit or deficient to support optimal erythropoiesis in developing red cell mass. Supply of iron to bone marrow is inadequate and total body iron is deficient. And we can see in the studies, diagnostic studies, MCV, MCH, ferritin, iron, etc. decrease, and transferrin that increase. In the laboratory studies, we can see MCV, MCH, ferritin and iron values decrease, and transferrin its value increase. And we can see what? Microcytic, hypochromic red blood cells. So that is the exact feature of iron deficiency anemia. The red blood cell look like microcytic and hypochromic. That's about iron deficiency anemia. We can go to the next question. Question number 6. A nurse is preparing to perform a Mantoux skin test. Which intervention apply in relation to this test? Select all that apply. Explain the procedure to the client. Obtain a 3 ml syringe with half-inch needle for injection. Mark the test area to locate it for reading 48 to 72 hours after injection. Bunch up the skin and insert the needle with the needle bevel facing up downward. Ask the client about previous history of positive purified protein derivative PPD reaction. Cleanse the injection site on the lower dorsal surface of the forearm with alcohol and allow it to dry. These are the options. We have to select all that apply. Read it again. Explain the procedure to the client. It is right. Obtain 3 ml syringe with a half-inch needle for the injection. It's wrong. Mark the test area to locate it for reading 48 to 72 hours after injection. Correct. Bunch up the skin and insert the needle. Wrong. Ask the client about previous history of Positive purified protein derivative. Yes, it is correct. Cleanse the injection site on a lower dorsal surface of the forearm with alcohol and allow it to dry. That is also correct. So option 1, 3, 5, 6. These options are correct. So you can see purified protein derivative PPD skin test, Mantoux test. We are injecting it intradermally within the skin in the inner surface of the forearm. And if the site become indurated hard after 48 to 72 hours, then the reaction may be positive. So understand how we are placing the needle and also how it is measuring like that. So the answer 1, 3, 5, 6, that is correct. And few points about few value points about tuberculin skin test. The needle size 1/2 inch, 26 or 27 gauge needle. Injection site lower dorsal surface of forearm. Then 0.1 ml of solution containing 0.5 tuberculin units of PPD we are injecting. Then we have to see a wheel 6 to 10 mm in diameter and we are reading 48 to 72 hours after injection. These are some of the value points. Keep in mind these points in your mind. See the next question. A nurse is performing a physical examination or physical assessment on a client with rheumatoid arthritis. The nurse assesses the client's hands and notes these characteristic deformities. Refer to the figure. You can see the figure. The nurse identifies this deformity as ulnar drift, rheumatoid nodules, swan neck deformity, and Buttonia deformity. These are the 4 options. Look at the figure. You can see what is that deformity. It's a case of what? It's a case of rheumatoid arthritis. All 4 options are correct. Means it is seen in rheumatoid arthritis, not apt as per diagram. What is the correct answer apt to the diagram? It means it is ulnar drift. The correct answer is ulnar drift. Okay. Then why we selected ulnar drift? We can see in ulnar drift that occurs when synovitis stretches and damages the tendons. Synovitis, it is one of the feature of rheumatoid arthritis. Inflammation of the joint is one of the feature of rheumatoid arthritis. It is an autoimmune disorder. Okay, so the tendon become inflamed and it become shortened and fixed. That cause what? Subluxation of the joint or drift of the joint. That's why ulnar drift is seen in rheumatoid arthritis. All other features are seen in rheumatoid arthritis. We can see what the joint deformities like ulnar deviation, swan neck deformity, Buttonia deformity, then bowstring sign. These are the other features of rheumatoid arthritis. And main feature is pain, insidious onset. Okay, then stiffness of the joint in the morning time, swelling, symmetrical involvement. Sometimes it can be asymmetrical also. And peripheral involvement, it can be central also. Polyarticular, it can be monoarticular also. It means it is an inflammatory disorder and it causes many problems. Okay, look at the diagram. It is in the late phase of the rheumatoid arthritis. We can see the Buttonia deformity, ulnar deviation, swan neck deformity. See, it is like the neck of swan, and also the Buttonia deformity. It is due to the problems or inflammation of the interphalangeal joints. We can go to the next question. A postoperative client has been placed on a clear liquid diet. Which item the client allowed to consume? Select all that apply. The question is placed on a clear liquid diet. So the answers: tea, broth, gelatin, pudding, vegetable juice. What are the correct options? Tea is correct, broth correct, gelatin, that is also correct. So option 1, 2, 3. Why we selected that? A clear liquid, because the options are clear liquids. 1, 2, 3 options are clear liquid diet that consists of foods that are relatively transparent to light. Clear liquid diet means that are relatively transparent to light and are clear and liquid at room and body temperature. Okay. We can go to the next question. Question number 9. A client with a leaking intracranial aneurysm has been placed on aneurysm precaution. A visiting family member wants to take the client to the unit lounge for just a few minutes. The nurse would use which of the following concepts when explaining why the client must remain in the room? Why the client must remain in the room? That you have to focus. So options are: the clients with aneurysm need isolation to cope with photosensitivity. Option 2, a quiet environment promotes more rapid healing of the aneurysm. Option 3, reduced environmental stimuli are needed to prevent aneurysm rupture. Fourth option, a client has disturbed thought process and needs reduced stimulation. What is the correct answer? The third option, reduced environmental stimuli are needed to prevent aneurysm rupture. Because environmental stimuli that cause what? The increased intracranial pressure that trigger bleeding and rupture of the aneurysm. That's why a nurse has to limit visitors and provide private and darkened room. Subduce the lighting, avoid direct bright artificial lights, and don't give stimulation. Okay, so these are the important nurse's tips while taking care of patient with aneurysm. The last question, question number 10. The nurse is caring for a client with cancer of lung who is receiving chemotherapy. The nurse reviews the laboratory result and notes that the platelet count is 18,000. Based on this laboratory result, which of the following would the nurse implement? So, main foci, that is 18,000. What is it? Platelet count. Then read the options. Contact precaution, bleeding precaution, respiratory precaution, neutropenic precaution. What is the correct answer? It is bleeding precaution. Why? Because when the platelet count is less than 20,000, the client is at risk for bleeding and the nurse would institute bleeding precaution. And monitor the platelet count closely in the client receiving chemotherapy because of the risk of thrombocytopenia. Okay. So this is brief about my session. If it is useful for you, please like, share my channel. Thank you.